Alrighty, so we're back again. It's Wednesday evening as our series continues, so I'm going to keep my glasses on so I can see. But anyways, what we talked about the latest research regarding chiropractic, and it was comparing chiropractic to physical therapy. Now, I can tell you from my years of being in practice that we've had patients that were injured in auto accidents where they had what we call mechanical spine pain symptoms, and they end up going to physical therapy and they had minimal results, or sometimes they didn't have any results as far as the pain. Now, don't get me wrong, physical therapy is real critical, for rehab, for a lot of issues. But when it comes to spinal problems, I think, the chiropractic cannot be beat. And now this research really talks about this, okay? So this is research out of the University or Cleveland Clinic. And this is actually 2017. Now, for many of you might not know that Cleveland Clinic is one of the world-renowned clinics around. Also, Mayo Clinic. So I'm going to read this, okay? The Cleveland Clinic Spine Care Path is a process-based tool designed for integration of electronic medical record to guide clinical workflow and help providers make evidence-based guidelines operational. So what they're saying is that they're saying that you have to have these guidelines. They've got to be proven. They got to be researched. Otherwise, this doesn't make sense for the future. So when we look at this, they go on to say, we know acute back pain is common, often resolves with simple therapy, even no therapy. Why? Because people are going to pop what? Pain pills. They're going to pop ibuprofen. They're going to pop maybe Advil or whatever that might be over-the-counter stuff. But in reality, is that really fixing anything? I don't think so, So what it's really doing is kind of like a cavity. All you're getting is this festering and increased, problem that's going to develop. And then eventually it's going to turn into like a spinal blowout, right? Well, God forbid, who wants a spinal blowout? Because now you're in a surgeon's office. And, any surgeon will tell you that there's really no cure. Even though the person might have a good outcome, that surgery might last, if it's spinal, might last 5 to 10 years, and that's it. So that's what Cleveland Clinic stated. According to Mayo Clinic, 2017, they're telling you to continue your activities, do over-the-counter medication, and hopefully it'll go away. But they also went on to state that physical therapy has been, this is the key, has been the cornerstone of back pain treatment. And that kind of really irritates us. That's why we're going after the medical doctors. And by the way, if you have a good relationship with your primary medical doctor, please give us a call. Give us an introduction. We'd love to sit down with them. Just recently, we sat down with some orthopedic surgeons. They're involved in extremities. Great people, great guys, and we had a good relationship established. And we just want to open the doors for our network so that we can, help people with all kinds of problems, because sometimes, there is surgery, unfortunately, is needed. So they talk about how physical therapy, the physical therapist can apply a variety of treatments such as heat, ultrasound, electrical stimulation, muscle release techniques to your back, muscles, and soft tissues to reduce pain. As pain improves, the therapist can get you an exercise and everything like that. Of course, that's what we do as well. But when they went on to compare, they actually took physical therapists and they took manual therapists that went to the special training, which was a 3 years additional training, right? So this is the consistency of today's pathways, because I think medical doctors just get into that, what they've used in the past, right? They've gotten used to referring their back pain patients to physical therapists, so that's been their, just basically their operating procedures. We're trying to change that, especially with this research. We want to get in their hands because it is all about research. So then they talk about the above two scenarios, which is the physical therapy with contemporary care paths for medicine regarding back pain. High velocity, low amplitude chiropractic spinal adjustments are not part of any medical institution's care plan. Now, isn't that sad? So Cleveland Clinic is stating this, Mayo Clinic is stating this, that chiropractic, the high velocity, low amplitude, from now on we'll say HVLA, high velocity, low amplitude. Chiropractic adjustments are not part of the mainstream medical establishment, despite the following compelling literature. So here it is, the latest reductions in pain sensitivity or hypoalgesia. What does that mean? Well, that's meaning reducing pain following spinal manipulative therapy, which is a chiropractic. Now, you know, if you've been a patient of ours, we don't call it spinal manipulation. What do we call it? It's an adjustment. Why is it an adjustment? Because it's specific. We're not going to get into all this mobilizing factors as far as, you know, we're going to twist your body one way, twist it the other way, and hope something works. That just doesn't cut it, you know? So the high velocity, low amplitude adjustment may be indicative of a mechanism related to the modulation of afferent input or central nervous system processing of pain. So what are they saying? It's chiropractic is all about the pain modulation, which is what? What is your nervous system? The main area, it's the brain. So we know, and we've known for quite some time right now, that unless we get your brain working, guess what? Your pain is not changing, right? So the neat thing is, when we apply this high velocity, low amplitude adjustment, right, with many of the type of procedures that we've done in the office, and there's a multitude of the different types of chiropractic adjustments, but when we do this, it is activating these receptors within our body, and we call these mechanoreceptors because they're pressure sensors, right? Receptors. When these receptors are activated, it then goes to the brain. The brain then releases the information, sends it down to the pain receptors, which are the nociceptors, okay? So that's cool. So there's a dampening effect occurring at the level of the central nervous system as well as the area of pain. So this also, they further asked a question, whether spinal manipulative therapy, again, you know that is spinal adjustment, elicits a general response on pain sensitivity, or whether the response is specific to the area where the adjustment is applied. For example, changes in pain sensitivity over the cervical, the neck, facets. These are the hinge joints in the back of the neck. Following a cervical spinal adjustment would indicate a local and specific effect, while changes in pain sensitivity in lumbar facets following a cervical spine adjustment would suggest a general effect. Well, here's what we now know. You cannot separate the neck, the mid-back, and lower back. They are not separate areas. What is it? This is one entire unit. So whatever's happened to the neck, okay, if my head goes forward like this, am I going to have mid-back problems? You betcha. It's just a matter of time, right? So what do we need to do? We need to correct. We need to fix these areas, adjust these spinal levels, but we also need to correct posture. And as many of you know, that's what we do. We go ahead and work on your posture after we make the adjustment, besides a different rehab. So it was pretty cool with this. They talk about pressure, pain, threshold, measure, remote anatomical sites, and a similar but non-significant change in local anatomical sites. And, you know, I don't think that's important. The bottom line is it helps all kinds of problems. So they then went ahead, and of course I told you earlier, they compared the manual therapy versus physical therapy, which was basically one and the same, but the manual therapist went an additional 3 years. Hey Mary, hi there Mary, thanks for watching. Mary up there, great acupuncturist up in the Santa Barbara area. Fantastic, we miss you Mary, you're awesome. So in the whole thing, here's what the key is. They found that these therapies that chiropractors offer, although many hastily consider manual therapy and chiropractic to be the same, it's not. So remember, the manual therapy is from the physical therapists that have gone on to specialize 3 additional years, right? So they say that substance P is perhaps the most compelling evidence of why a chiropractic spinal adjustment should be considered the first choice for spinal care. That's exciting news for us, right? Because when we open the conversation with most of the medical doctors, you know, they've only been taught or heard what they hear, right? They've never been educated by a chiropractor, and buddies of mine are now entering into the medical universities and educating these upcoming doctors, because they have elective programs in certain specialties. So it's kind of cool. That's my goal. And if you have any idea, please get me into UCI Medical School or UCLA or USC. I'd love to be able to talk there. I'd love to be able to do that. So this is a key thing. We just talked about the substance P because this is the most compelling evidence of why chiropractic spinal adjustment should be considered the first choice for spinal care. In a series of studies, investigated the effect of the spinal high velocity, low amplitude adjustment and causing cavitation. So many of you, when we make that adjustment, you hear that popping sound? That's what we call cavitation, okay? The air being released from the fluid-filled sacs. So this is sufficient to produce an auditory release or a palpable joint movement. But it activates the cells of the immune system. Isn't that unbelievable? That's phenomenal. Because over the years, and I remember, I got to tell you this story. When I was in chiropractic school, all I did was study my tushy off, right? And I remember I was rooming with a guy that was just about to graduate. Well, I was going to bed like 7 or 8 o'clock at night, and he said, "Mike, what are you going to bed for?" I said, "I'm not feeling good. I feel like I'm coming down with a cold." Well, he said, "Let me adjust you." I said, what is that going to do, right? I had chiropractic care before, but like many people, pain, aches, and that type of thing. He said, "Let me adjust you. It's going to activate your immune system. 2 things are going to happen. One, that cold will be gone, possibly tomorrow, or you're going to have less severe symptoms." He adjusted me, and you know what? I woke up, no ball. That just blew me away, right? So now we know why this has happened, because the activation of the immune system. Well, where's our nervous system? Where's the majority of our immune system? It's where? It's in the gut. Well, they used to say 60%, now 70%. Now I heard recently by another doctor, 75% of our immune system is in our gut. But also our gut is also known as a second brain. That's why we always talk about what? We talk about what you put in your mouth, right? That's why we say no gluten, no soy, no corn, and all that other stuff. And you might get tired of us preaching that, but we're going to keep on preaching. They found that a single adjustment to either the thoracic or lumbar spine, the low back, the mid-back and the low back, resulted in short-term priming of these polymorphal nuclear neutrophils. What that is, those are those cells that respond in the immune system. When there's anything that comes in our body, that the neutrophils. The neutrophils are basically all about, the bacteria. And they did this in vitro, and they had an enhanced respiratory burst as measured by this luminescence, in subjects with and without symptoms. So this SP is an 11 amino acid polypeptide, and is one of a group of neuropeptides, right? So these are proteins, enzymes that are all involved, known as tachykinins. Well, if you understand this, it's all part of the immune system response. These are peptides that are produced along the spinal column, this specific area, dorsal root ganglion, and are released by slow conducting, unmyelinated C polymodal nociceptors. Remember we talked about that? We talked about the nociceptors. Those are the pain receptors. So what does the adjustment does? The adjustment, it's activating the mechanoreceptors. It's going up into the brain. It's being integrated, and it's coming down. It's dampening those pain receptors and nociceptors. So that is just awesome. And then they're releasing the peripheral tissues from the peripheral terminals. And so this is modulating the inflammatory process by neurogenic inflammation. They are also relieved from the central terminals, which we get into more and more of the spinal cord. But ultimately what's happening is it's having an effect throughout the body. So when they did the research, okay, how can you adjust the lower back and have an effect on the neck, right? How can you adjust the neck and have an effect on the low back? It's pretty amazing. And that's what kind of excites us, because the whole idea is we do what we do because we love what we do and because we see results. I was just seeing a new patient tonight, when he was talking about that. He was talking about how he's passionate in what he does and helping people, and that's a reward. Yeah, absolutely. It gives us a reason for being and continue to do what we do. So we'll probably be practicing when we're 85, 90, and hopefully we'll still have good visions. So when we work on you, we'll be fine. So this neurophysiological effect of the spinal adjustment seems to be force threshold dependent. That means that you cannot do low amplitude, low threshold. It's got to be high velocity, low amplitude adjustments that have this type of effect. And the SP studies even use sham manipulation as a control, consisting of low velocity, low force thrust to the selected area, rather like mobilization. So when we talk about manipulation and mobilization, that is more of what the physical therapist does. It is not what we do. It is chiropractic adjustments. So the spine's got three areas, right? The joint, you got to think about the disc, that's a joint, right? So you got the vertebra, and then you got the disc in between, which is a spongy shock absorber that's going to compress and decompress. And then you got the back part of the joint, which is the hinge, which allows, just like a hinge on a door, allows for the motion. So this was pretty exciting because here's the end conclusion. Given that chiropractors are proponents of health maintenance care, patients with work-related low back, this is workers' comp, who are treated by chiropractors would have a lower risk of recurrent disability because that specific approach was used. So that's interesting because in all phases, from what I understand, it's only chiropractic that has really achieved that maintenance basis with the workers' compensation patient because of the reduction in that disability. After controlling for demographic factors and multiple severity indicators, patients suffering from nonspecific work-related low back pain who received health services mostly or only from a chiropractor had a lower risk of recurrent disability than the risk of any other provider type. Wasn't that awesome? So I had to come on and say this and talk about this because this is a big issue. You know, with a lot of people, they don't understand chiropractic, and you know, being in practice now for over 35 years. Yeah, time goes by fast. This is pretty exciting. And when we talk about, you know, how much could be saved, okay, we're talking, you know, billions. I mean, here it says that there has reached, not correcting anything, just managing it. This is for low back pain patients. This low back patient has reached $106 trillion. $86 trillion in healthcare costs and $20 trillion in lost productivity. Now, let me close by saying this. What's happened in England is that they opened up a chiropractic school, and that was part of Princess Diana. Now they got a chiropractic school in Spain. I think that they're opening one in France or Scotland, somewhere like that. Italy, well, I had a chance of practicing it when I first came out of chiropractic school, and I was a dummy, and I didn't do that. But Europe, you know, in their socialized medicine has nothing to gain. That's why they're wanting to provide that health service that is really the best for individuals. Get them back to work, get the quality of living and life, of course, and make sure that we do well in the future. If you have any questions, you can always reach us at valentinechiropractic.com, or you can call us 714-964-9566. We'd like your input if you'd like to hear something about anything in particular from a standpoint of health and wellness. We could talk, you know, I'm thinking about doing a presentation on nutritional ketosis, if you're not familiar with that. Myself and Dr. Leonard, he's been doing a bit of that. We've been doing intermittent fasting. It's been phenomenal. My exercise routine has really improved quite a bit. I don't seem to sleep as much or need as much sleep, but it also creates what we call brain clarity. So instead of us being sugar burners, we convert you into more of a fat burner. With that, I'll close. Give us some information, what you'd like to hear about. Please comment, and see you soon. Thanks for watching. Bye-bye.